Medical Health Services Recruitment Board, Staff Nurse Recruitment, Telangana. Part 2. Most important questions, MCQs, easy to prepare. So, ఇక్కడ మనకి ఫస్ట్ పార్ట్లో 1 to 25 క్వశ్చన్స్ ఉన్నాయి. నెక్స్ట్ పార్ట్ నుంచి ఇక్కడ ఉంటున్నాయి. వెల్కమ్ టు మై ఛానల్. స్టే సేఫ్, స్టే హెల్దీ. క్వశ్చన్ కేర్ఫుల్గా చదవండి. ఆన్సర్ కన్ఫ్యూజ్ అవ్వకుండా చెప్పండి. అండ్ ఎన్ని ఆన్సర్స్ మీకు కరెక్ట్ అయ్యాయో కామెంట్ బాక్స్లో కమెంట్ చేయండి. ఇప్పుడు స్టార్ట్ చేసుకుందాం. సబ్స్క్రైబ్ చేయండి, షేర్ చేయండి. ఇన్ ద ఫాలోయింగ్ విచ్ ఈజ్ బోత్ ఎండోక్రైన్ అండ్ ఎక్సోక్రైన్ గ్లాండ్? ఏ పిట్యూటరీ, బి థైరాయిడ్, సి pancreas, D adrenal. Did you got the answer? Yes, I think it's C pancreas, because pancreas is an organ that has both exocrine and endocrine functions. Pancreas secretes digestive enzymes and also hormones such as insulin. In the following, which is the most abundant cation in extracellular fluid? A sodium, B potassium, C calcium, D chloride. Guess the answer. Yes, the answer is A sodium. Sodium is the most abundant cation in extracellular fluid. It plays a key role in maintaining homeostasis. Right answer is A. The blood vessel which connect the artery and vein. A venule, B capillary, C arteriole, D sinus. Guess the answer. Did you got the answer? Yes, the answer is B. That is capillaries. These are the blood vessels that connect arteries to vein. Capillaries are the smallest and most numerous blood vessels in the body. Concentration of oxygen in expired air is about A 0%, B 16%, C 21%, D 4%. Guess the answer. Yes, it is B 16%. Inhaled air contains about 21% oxygen. The composition of exhaled air is nitrogen 78, oxygen 16, carbon dioxide 4 to 5. Thermophilic bacteria grow at the following minimum temperature: A 20 degrees, B 35 degrees, C 55 degrees, D 85 degrees. Can you guess the answer? Actually, it is C 55 degrees, which is given here, but normally the minimum temperature is 45 degrees for thermophiles. Sterilization of endoscopy is done: A by autoclaving, B by UV rays, C by 2% phenol, D by 2% glutaraldehyde. Guess the answer. Got the answer? Yes, it is D by 2% glutaraldehyde. Endoscopic instruments do not tolerate autoclaving. It is a cold sterilant used to clean and disinfect heat sensitive equipment. Pathogen means microorganism which causes diseases, B organism which are found in animals, C organism which are beneficial for us, D organisms which are found in plants. Guess the answer. Yes, it is A microorganism which causes disease. Pathogen will be like viruses, bacteria, fungi and parasites, some of the examples of pathogens. Vidal test is performed: A to identify the typhoid fever, B to identify the AIDS, C to identify the cause of diarrhea, D to identify the cause of dysentery. Yes, it is A to identify the typhoid fever. It is a blood test that checks for antibodies against Salmonella typhi, which causes typhoid fever. Asepsis means: A freedom from infection, B freedom from anxiety, C freedom from noise, D freedom from pain. You will learn this in terminology. Have you guessed the answer? Yes, it is A freedom from infection. The goal of asepsis is to prevent contamination, especially in surgical incisions and other suspectable areas of the body. Stain used to identify acid-fast bacilli is A. Leishman, B. Ziehl-Neelsen, C. Gimsa, D. Wrights. Have you guessed the answer? Yes, it is B. Ziehl-Neelsen. So Ziehl-Neelsen is used to identify acid-fast bacteria, including Mycobacterium tuberculosis, the cause of tuberculosis. Benedict's test in a urine sample is done for the detection of A. acetone, B. glucose, C. bile salt, D. bile pigment. Have you guessed the answer? Yes, it is an easy answer. It's B. glucose. So Benedict's solution is a chemical reagent that detects the presence of reducing sugars such as glucose in urine. It's a deep blue alkaline solution made of sodium carbonate. For effective sterilization, steam in an autoclave should be at a pressure of 15 pounds per square inch for 30 minutes and at a temperature of A 100 degrees, B 110 degrees, C 121, D 131. Yes, it is C 121 degrees. To achieve chamber temperature of at least 250 degrees Fahrenheit or 121 degrees centigrade for a prescribed time, usually 30 to 60 minutes they keep in autoclaves. Klebs Leafler bacillus is the name of which of the following bacteria? A. Clostridium tetani, B. Haemophilus influenzae, C. Corynebacterium diphtheria, D. Lactobacillus. Yes, you are right. The answer is C. Corynebacterium diphtheriae. So it is also known as Klebs Leafler bacillus. It is characterized by formation of yellowish or grayish membranes over the tonsils. The answer is C. Which of the following is not a species of Plasmodium parasite? A. Plasmodium ovale, B. Plasmodium mexicana, C. Plasmodium malaria, D. Plasmodium vivax. Yes, the answer is B. Plasmodium mexicana. There are several species of Plasmodium, a single-celled parasite that causes malaria in humans and other vertebrates. Life cycle of malarial parasite was first described by A. Ronald Ross, B. Robert Koch, C. Louis Pasteur, D. Banting and Best. Yes, it is an easy answer. Your guess is right. A. Ronald Ross. So the life cycle of malaria parasite was first described by British Army surgeon Ronald Ross in 1897. Ross was awarded the Nobel Prize in Medicine for his work on malaria. HIV virus belongs to which of the following groups? A. Flavivirus, B. Retrovirus, C. Rhabdovirus, D. Hepadnavirus. Have you guessed? Yes, it is B. Retrovirus. HIV belongs to the retrovirus group of viruses because it uses RNA to encode its genetic information. Which infecting serotype of dengue virus is most dangerous? A. Type 1, B. Type 2, C. Type 3, D. Type 4. Have you guessed the answer? Yes, it is B. Type 2. Dengue virus serotype 2 is considered the most virulent of the 4 dengue virus serotypes. The most often cells from blood infected by HIV is CD4 helpers T lymphocytes, B lymphocytes, C CD3 suppressor T lymphocytes, D polymorph. Guessed? Yes, it is A CD4 helper T lymphocytes. The most common cells infected by HIV is CD4 cells, which are a type of white blood cells that are a part of immune system. So they fight infections. The causative organism of tuberculosis is A. Micrococci, B. Mycobacterium tuberculosis bacilli, C. Streptococci bacilli, D. Meningococci. Easy one. It's B answer, Mycobacterium tuberculosis bacilli. TB is spread through the air which people with active TB cough, sneeze or spit. Urine sample for culture is collected from A. First urine, B. Last urine, C. Midstream urine, D. Both A and B. Did you guess? Yes, it is option C. Midstream urine. A patient urinates first to clear the urethra, then collects a midstream urine sample in a clean container. The following factors influence microbial growth except A. Temperature, C. Darkness, B. Moisture, D. Disinfection. Here the answers got jumbled. C should be down and B should be up. Yes, the answer is C. Darkness. In dark, bacteria reduce their intake of organic carbon and metabolism and instead increase protein production and repair. Immunity means A. Antibodies and antigen reactions, B. Transfer of maternal antibodies across a placenta, C. Level of resistance of a person to a particular disease, D. Acquired immunity by immunization. Yes, the answer is C. Level of resistance of a person to a particular disease. It is a body protection against disease. The protection is called immunity. Humans have 3 types of immunity. Trichomonal infection is caused by A. Protozoa, B. Fungus, C. Yeast, D. Bacteria. Did you guess the answer? Yes, it is answer A. Protozoa. So, trichomoniasis is caused by one-celled protozoan, a type of a tiny parasite called Trichomonas vaginalis. Which of the following is the father of microbiology? A. Louis Pasteur, B. Robert Koch, C. Antony van Leeuwenhoek, D. Landsteiner. Yes, you are right. The answer is A. Louis Pasteur. In 1822 to 1895 was a French biologist who is often regarded as the father of modern microbiology. In the following, which is not sterilized by antiseptic solution? A. Suction catheter, B. Rectal tube, C. Scissor, D. NG tube. Yes, you are right. That is answer C. That is scissor, which is not sterilized by antiseptic solution. Write the answers in the comment box. Let me know how many of you have written correctly. So subscribe my channel, share with your friends and stay tuned for more. Part 3 will be uploaded soon.